The conception for the study arose from a common clinical scenario that arises, which is in patients with premenopausal, hormone receptor positive, HER2 negative breast cancer in the early stage, whether to recommend chemotherapy in the context of low recurrence scores. So as NCCN guidelines stand currently, for true involvement of 1 to 3 nodes, we recommend chemotherapy. For node negative disease, we do not recommend chemotherapy based on recurrence score cutoffs, but there aren't explicit guidelines for what to do in the context of micrometastasis. So we used the national registry and found that 6.1% of patients in the early stage setting had micrometastasis, so this is not a negligible population. We confirmed the prognostic value of ODX prognosticating overall survival in patients with micrometastasis. This was not a surprise. We know it's a prognostic biomarker in the node positive and node negative setting. We looked at patterns of practice and saw that with patients with recurrence scores below 26, chemotherapy was used most common when there was involvement of 1 to 3 lymph nodes, least common when there was 0 involved lymph nodes. But for patients with micrometastasis, the use of chemotherapy was somewhere in between. And this, we're interpreting as a lack of consensus for how to treat these patients. Lastly, we wanted to explore overall survival, and we found that in patients with recurrence scores below 26, when there was involvement of 1 to 3 lymph nodes, there was an overall survival benefit associated with chemoendocrine therapy over endocrine monotherapy. However, in patients with micrometastasis, there was no difference in overall survival, and this mirrored the outcomes that we saw in patients with node negative disease. So even though this is the retrospective setting, we're identifying a subpopulation of patients where treatment de-escalation may be appropriate, but we have to replicate it with prospective data. Also knowing the limitations that we looked at overall survival and not disease-free survival.